Well, heart failure is the inability of the heart to pump blood through the circulatory system to meet the body's demands.
So if the body's asking for a certain amount of cardiac output liters per minute and you're unable to provide that and the oxygen that goes with it, then the whole host of symptoms and signs that follow are what characterizes heart failure.
These symptoms occur first when patients try to exert themselves doing their daily activities, walking, doing household chores, going up steps. These symptoms that first occur are usually shortness of breath. That's probably the most common complaint of a patient with heart failure is that, doctor, when I'm trying to push the vacuum cleaner around the house, I feel short of breath. And that means to me that the heart is just not pumping as well as it should.
So if you notice that you are short of breath with your usual amount of activity and something has changed, if you're excessively fatigued for the same types of things that didn't used to make you tired, those are kinds of things that you might watch out for as signs and symptoms of heart failure. Later on, as it becomes more advanced, you might develop swelling in your abdomen, swelling in your legs, an inability to lie down flat because you get short of breath. Those are the types of things that we might see in a little more advanced state of heart failure.
In America, the most common cause of heart failure is coronary artery disease. And so the risk factors of coronary artery disease end up being the most common risk factors of heart failure. And these risk factors include hypertension, diabetes, smoking, and obesity. And so those are typically the patients that we most commonly will develop heart failure, is that they've had some pre-existing atherosclerosis in their coronary arteries. The other potential etiologies include if you have a family history of heart disease. There are certain hereditary or familial type of cardiomyopathies which manifest in certain families. Alcohol is another one that alcohol in and of itself can cause cardiomyopathy and therefore lead to heart failure.
Then the large basket of patients who are at risk of heart failure from non-coronary issues include people who might get chemotherapy for certain types of drugs, with certain types of drugs, people who might have diseases of iron and copper storage, viral infections in your heart. So a number of things can actually cause heart failure not related to coronary disease, and that would be termed non-ischemic population. So basically then, that's a broad range of patients who are much harder to define.